Bonjour, c'est Frédéric Trudeau, l'interprète présent en ce moment. Je suis dans la...
Salut Frédéric, quand vous êtes prêt, je vais changer votre nom. Vous pouvez tester votre caméra aussi.
Oui. OK, un instant. Là, désolé, on n'a pas eu le temps de faire beaucoup de tests, là. Alors, je vais juste faire tester avec mon collègue ici en ce moment. Ce ne sera pas très long, OK? Je vais juste voir. OK, c'est pas mal. OK. C'est bon. Ben, ça va ressembler à ça. C'est correct pour vous?
Frédéric, vous revoyez de votre côté ce qu'on voit. De notre côté, ça a l'air beau. Je vous laisse vraiment guider ça.
Super. Excellent. Je vais donc fermer le son et puis je vais vous laisser faire votre travail.
D'accord. D'abord, Gisèle sur la ligne. Si vous êtes prêt, vous pouvez transférer la ligne.
Parfait. Donc, je transfère et j'enlève la musique. Merci.
This conference is being recorded. Cette conférence est enregistrée.
Whenever you're ready, Amanda.
All right, if we are good to go, then we will get started. Thank you so much to everyone for joining us today. My name is...
Merci d'être présent. Je suis Amanda Conley. Je serai la modératrice aujourd'hui. Nous accueillons l'administratrice en chef de la santé publique, Dr. Theresa Tam, et le sous-administrateur en chef, Dr. Njoo. Vous avez des déclarations d'ouverture. Vous aurez la parole. Ensuite, on passera aux questions. Merci beaucoup. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et
that informs the ongoing response and planning for longer-term management of COVID-19 in Canada. Since our last update, multiple indicators show that Canada is past the peak of the Omicron wave, though infection rates remain elevated and hospitals are heavily strained. In the presence of overall high vaccination rates, health authorities are closely monitoring improvements of these epidemiological indicators in order to guide the stepwise easing of measures. For the immediate future, key preventive measures remain important for relieving the accumulated pressure on hospitals. Some measures will also be important for protecting vulnerable populations and maintaining readiness for a possible resurgence. This includes reducing vaccination coverage gaps and encouraging the use of personal protective practices, such as avoiding crowding, opting for well-ventilated spaces, and wearing masks as appropriate. Though we are hopeful we are approaching a period of reduced transmission, allowing Canadians a chance to regain a sense of normalcy, we know that SARS-CoV-2 virus is not going away. To that end, we must also use this time to prepare for the longer term by maintaining a cohesive approach across the country, strengthening capacity for rapid detection and response, and using personal practices as and where needed to better protect ourselves and each other.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et de modélisation effectués au pays qui orientent les interventions en cours et la planification de la gestion à long terme de la COVID-19 au Canada. Depuis la dernière mise à jour, de nombreux indicateurs montrent que le Canada a dépassé le sommet de la vague Omicron, même si les taux d'infection restent élevés et que les hôpitaux sont fortement sollicités. Compte tenu des taux de vaccination généralement élevés, les autorités de la santé surveillent de près l'amélioration de ces indicateurs épidémiologiques dans le but de guider l'assouplissement progressif des mesures. Dans les médias, l'utilisation des mesures préventives clés demeure important pour atténuer la pression exercée sur les hôpitaux. Le recours à certaines autres mesures sera également important pour protéger les populations vulnérables et se tenir prêt à faire face à une éventuelle recrudescence du virus. Il faudra notamment réduire les lacunes sur le plan de la couverture vaccinale et promouvoir le recours à des mesures de protection individuelle comme éviter les foules, privilégier les espaces bien ventilés et porter un masque lorsque nécessaire. Bien que nous ayons bon espoir d'approcher d'une période où la transmission sera moindre, permettant aux Canadiens de retrouver un sentiment de normalité, nous savons que le virus SARS-CoV-2 ne disparaîtra pas. Dans cette optique, nous devons également profiter de cette période pour nous préparer pour le long terme, en maintenant une approche unifiée à travers le pays, renforcer la capacité de détection et d'intervention rapide et utiliser des mesures de protection individuelle au besoin pour nous protéger et protéger les autres.
Slide 1. Since the last epidemiology and modeling update in January, multiple indicators of COVID-19 disease spread, including lab test positivity, RT or effective reproduction number, wastewater surveillance trends, and daily reported cases indicate that Canada is past the peak of the Omicron wave nationally. Although testing continues to underestimate true infections, many jurisdictions across Canada are now reporting weekly declines in the average number of reported cases. As of February the 16th, the latest national 7-day average was over 8,100 new cases being reported daily, which is a 27% decrease compared to the week prior.
Diapositive 2. La forme de ces courbes montre à la fois une brusque diminution du nombre.
So that while there is a drop in the number of tests being conducted, percent positivity continues to decline, which aligns with multiple other data sources indicating reduced levels of infection.
Slide 3. Community-based wastewater surveillance also provides a way to estimate the true number and trend of infections during this period of reduced general population testing. The black line shows the number of actual reported cases from traditional case-based surveillance in 5 Canadian cities, while the blue line shows the estimated number of true cases based on community-based COVID-19 wastewater signals in those same cities. This method, which aligns with other data sources, indicates that the trend and peak of the Omicron wave involves a much higher number of cases than were detected through case-based surveillance. Notably, the estimated blue line trajectory does not take into account the easing of public health measures, which could result in some bumps over the coming weeks.
Diapositive 4. Les tendances liées.
Slide 4. Hospitalization trends are shown for Canada's 6 most populous provinces, while recognizing that Omicron has been widespread, impacting hospital capacity across the country. Despite a lower risk of hospitalization and even lower risk of ICU admission associated with Omicron compared to Delta, even the smaller proportion of cases that resulted in hospital and critical care admissions has been substantial. Together, the unprecedented volume of cases over a short time period and increased staff illness and isolation requirements have had a heavy impact. Fortunately, we are seeing continued hopeful signs of slowing trends in hospitalization and critical care. Over the past 2 weeks, many jurisdictions reported weekly reductions in the daily number of people with COVID-19 being treated in hospitals. These declines are most evident in Ontario and Quebec, which were the first to experience the Omicron surge, and now appear to be past the peak of hospital and critical care impact. Compared to last week's update, the latest data are showing a 16% decrease in the number of people with COVID-19 being treated in hospitals daily. However, that is still a 7-day average of over 8,100 in hospitals each day, including 900 in intensive care and 95 deaths were reported daily. Relieving the pressure on hospitals is a key priority as we cautiously come out of the Omicron wave to recover as well as strengthen our capacity and resilience to manage SARS-CoV-2 virus over the longer term.
Slide 5. It is important to note that based on selected hospitals' data for the month of January, 40% of patients were admitted due to their COVID-19 infection, while the remainder were admitted for other reasons. While the overall volume of Omicron cases drove up hospitalization rates across all age groups, the age distribution of cases in hospital is similar to previous waves of the pandemic, with hospitalization rates highest among older Canadians. Over the past month, severe outcomes, including the number of hospital and ICU admissions and deaths, were highest amongst adults 60 years of age and older. Cases in infants aged under 1 year are almost 6 times more likely to be hospitalized than children aged 1 to 4 years. But while hospitalization numbers have increased in this age group compared to previous waves, they remain low overall. Likewise, children continue to have low rates of intensive care admissions overall. However, infants aged under 1 year have the highest rates, which over the past month have been higher than at any other time previously during the pandemic. This is why it is particularly important for parents and close contacts of infants and young children to continue taking measures to reduce the risk of exposure among children.
Diapositive 6.
Slide 6. Canadians aged 12 years or older have 88% or higher vaccine coverage with at least 2 doses, and coverage is still increasing among 5 to 11-year-olds who more recently became eligible for vaccination. As of February 13th, 56% have at least 1 dose. All told, there are currently more than 5.6 million Canadians who are eligible but are not yet vaccinated or have less than 2 doses of COVID-19 vaccines. This week, Health Canada approved the Nuvaxovid vaccine, which is the first COVID-19 recombinant protein subunit vaccine to be authorized for use in adults in Canada. Novaxovid vaccine uses a protein-based vaccine technology, which has been in use in Canada and around the world for many years for prevention of other vaccine-preventable diseases such as pertussis and hepatitis B. Among the more than 2.5 million Canadian adults aged 18 years or older who have not yet been vaccinated against COVID-19, Nuvaxovid vaccine provides an option for those who cannot or do not want to receive an mRNA vaccine.
Slide 7. As well, many Canadians who have completed their primary series with at least 2 doses need a booster dose to restore immunity that may have waned over time and to provide better protection against the Omicron variant. Given substantially higher risk of hospitalizations and critical illness with increasing age, improving booster dose coverage, particularly among adults aged 50 years or older, is particularly important.
Diapositive 8.
Slide 8. Since vaccines became available, hospitalization rates have been consistently lower among fully vaccinated people compared to unvaccinated people. This protective advantage has varied but remained substantial across pandemic waves, clearly demonstrating that having 2 or more doses is highly protective. For the month of January, even as Omicron began to surge in Canada, vaccinated people continue to be at lower risk of hospital admission than unvaccinated people, with a hospitalization rate that was 4 times lower among fully vaccinated people than among unvaccinated people, and 13 times lower among fully vaccinated people with an additional dose than among unvaccinated people. In general, protection against hospitalization is approximately 90% or more soon after an mRNA COVID-19 vaccine booster which is about 10 to 20% higher than shortly after the second dose.
Slide 9. This updated longer range forecast showing estimated daily cases on the left and daily hospital admissions on the right illustrates how the Omicron wave could evolve in the coming weeks, with many jurisdictions easing public health measures. Note, due to changes in data availability, there is significant uncertainty in these forecasts. The three scenarios shown in each figure show that while Omicron activity has likely peaked, easing of public health measures could still lead to resurgence. The blue line trajectory show that with a moderate effect of easing public health measures, we could expect a limited resurgence of daily cases, with potential for a more modest resurgence in daily hospital admissions towards the spring. The red line trajectory shows that with a more substantial effect of easing measures, we could expect a larger resurgence of daily Omicron cases, potentially exceeding prior peaks. But similarly, the peak of daily hospital admissions could be much lower. While resurgence of cases is not unexpected, given the characteristics of the Omicron variant, the good news is that current levels of immunity in the Canadian population are expected to reduce the impact of the Omicron infections going forward. In particular, with an increasing proportion of breakthrough infections in people with some prior immunity from vaccination and/or infection, it is expected that a smaller proportion will require hospital admission, such that the impact on our healthcare system could be less severe, even with a large number of cases.
Diapositive 10.
Slide 10. The SARS-CoV-2 virus has been continually evolving since its emergence in the late 2019, resulting in the occurrence and accumulation of random mutations that can impact virus characteristics, such as transmissibility and severity. Some of these mutations have helped the virus spread more easily, including by evading immune protection as it passes from person to person. In this way, accumulated mutations can result in new variants of concern, which may emerge from existing variants. Or new variants, such as Omicron, can also appear more suddenly if accumulating mutations stay hidden from our surveillance. For example, if the virus evolves in an immunocompromised person or an animal host. This highlights why we need to monitor and be prepared for emergence of new variants that could appear suddenly.
Slide 11. Almost all countries around the world have reported the Omicron variant, although some are further ahead than others in coming through the Omicron wave. We are closely monitoring other countries that have similarly passed the Omicron peak, including those that have begun to ease public health measures, having achieved a high vaccination coverage. Likewise, we are monitoring the impact of genetic sublineages of the Omicron variant, such as the BA.2, while continuing to look out for the emergence of other variants of concern, as well as transmission of SARS-CoV-2 amongst animal populations. Global collaboration remains as important as ever, including strengthening surveillance and research and ensuring access to vaccinations and treatments.
Diapositive 12. Ensemble,
Slide 12. Together, the latest modeled scenarios show that while we need to continue a cautious approach to easing measures and closely monitor severity indicators, there is room for optimism. Thanks to the sacrifices and enduring strength of Canadians, we are in a stronger position than ever before. Vaccination, together with public health measures and changes we have made to our daily routines, have worked to minimize COVID-19 serious harms and save lives. Although resurgence is still possible, Canada's stronger foundation of protection, gained through the development and application of a range of tools, can help us achieve a more balanced and sustainable approach for long-term management of COVID-19 as we transition out of the crisis phase, we can continue to rely on the crucial tools for prevention, early detection, and response. As we get out of the crisis phase, we can continue to rely on the crucial tools for prevention, early detection, and response, including vaccines, testing, robust surveillance, treatments, and public health and healthcare infrastructures. For public health and individuals alike, maintaining caution and a state of readiness will be our strongest advantage as we recover and enhance our surge capacity for future response. For individuals and families, this includes keeping COVID-19 vaccinations up to date, including getting a booster dose when eligible, being aware of evolving risks, and maintaining individual protective practices, such as wearing masks, staying home when sick, and improving ventilation of indoor spaces. Thank you. Thanks to all Canadians for their ongoing efforts.
Thanks to the sacrifices and enduring strength of Canadians, we are in a stronger position than ever before. Vaccination, together with public health measures and changes we have made to our daily routines, have worked to minimize COVID-19 serious harms and save lives. Although resurgence is still possible, Canada's stronger foundation of protection gained through the development and application of a range of tools can help us achieve a more balanced and sustainable approach. As we strive to reduce serious outcomes, these tools can help support vulnerable populations and reduce impacts on health systems while minimizing societal disruption. As we transition out of the crisis phase, we can continue to rely on crucial tools for prevention, early detection, and response, including vaccines, testing, robust surveillance, treatments, and public health and healthcare infrastructure. For public health and individuals alike, maintaining caution and a state of readiness will be our strongest advantage as we recover and enhance our surge capacity for future response. For individuals and families, this includes keeping COVID-19 vaccinations up to date, including getting a booster dose when eligible, being aware of evolving risks, and maintaining individual protective practices such as wearing masks, staying home when sick, and improving ventilation of indoor spaces. For ongoing efforts of countless Canadians, thank you, merci, miigwech.
Great, thank you very much. I believe that concludes the presentation from our guests today. So we will start with the question period. It'll be one question, one follow-up. As a reminder, on va commencer la période de questions maintenant.
We will now start with the question period. One question, one follow-up.
Aiden Chimandi with iPolitics. And I will just unmute. Let's see here. Sorry about this.
Hello, can you hear me? Thank you.
Yes.
Happy Friday to everyone. So the NACI document released yesterday says Novavax is good for appealing to vaccine hesitant folks. So are you aware of any government plans to use it for that purpose for Canadians? And if so, can you explain how this will be done?
Yes, so we're in close contact with provinces and territories, and they are the ones who are going to be telling us how much of the vaccine they need based on their understanding of their population's requirements. On the whole, I think people are looking at, well, what's the proportion of the population that hasn't got a booster, even though they already had 2 doses? That's one statistic. But then, of course, there are some Canadians who have never really even got their first dose. So these are the sort of baseline statistics that provinces will have. And then there are surveys and public opinion research looking at, well, what's the proportion of individuals who have not yet got a vaccine who may want an alternative vaccine. And these vary, I think, across the country, but anywhere between 10 to 50% of those who have not yet been vaccinated said they would be interested in an alternative vaccine. And so the Novavax vaccine offers them that potential option.
It's Dr. Njoo, and I would just underscore the point that I think in Canada, we're so fortunate to have such a selection, a choice of vaccines now, obviously with the approval of the Novavax vaccine. And I think Canadians really need to understand, recognize, and appreciate the fact that we have that choice. And as Dr. Tam said, if there are those individuals that haven't gotten their first or second dose because of some hesitation or questions about the mRNA vaccines, which still obviously with the hundreds of millions of doses of vaccine administered around the world with a good obviously effectiveness, I think is still a very good choice. But now we have an additional choice, so I think Canadians can feel very good about the fact that they have this choice, and I think really it underscores the importance of going forward and getting vaccinated.
And in terms of actually, in terms of actually reaching out to these folks, like what do you recommend is the best way to reach them? Are we talking advertising campaigns?
Yes, the actual operationalization of the vaccine programs are done by provinces and local jurisdictions, but I think it would be more of a multifaceted approach. There's never been a one-size-fits-all for every population, but certainly outreach more broadly, like we're doing now, and public announcements, but also at a more local level in terms of the understanding of which populations might still need a different vaccine. Some individuals, of course, have some contraindication based on maybe a reaction that is severe, that's been assessed post mRNA vaccine. So those individuals would consult with their physicians on the risk and benefits of receiving different vaccines. And so outreach to healthcare providers, making sure they know that this vaccine is an option for their patients is another domain, and they're in the best position to explain the relative risks and benefits of the options in front of an individual. So I think it'll be multifaceted approach. And I can't tell you what channels the vaccines are going to be provided in, because that's in the local setting, but we do know that this vaccine is fridge stable, which also makes it easier logistically to distribute.
Thank you. Okay, our next question will be from Sébastien Desrosiers avec Radio-Canada.
Bonjour, merci.
Good morning. Thank you for taking my question. First of all, I would like to ask what you think about restrictions at the border, travel restrictions that were announced this week by Minister Duclos. More specifically, why is it always necessary to show a lab antigen test? When will those restrictions be lifted? Answer, Dr. Njoo here. I could start. Thank you for your question. It's all about analyzing scientific evidence at the border and to also look at the epidemiological data of what is happening in the country compared to other foreign countries. What we are seeing at the borders, even with the requirement of a molecular test and now a rapid antigen test, we are seeing a certain percentage of travelers coming to our borders testing positive for COVID-19. It's less so for vaccinated people compared to unvaccinated people. There's still a percentage. So I think it's something to monitor, because we know that ultimately, maybe in the future, we'll have to be looking at the tolerance threshold and risk management, because when you look at what is happening in Canada compared to other countries, we need to find a balance. but now it's a problem. We are continuing to analyze scientific data. Maybe next week, with the data that we recently received during the week ending 12th of February, about 2% of totally vaccinated people are still testing positive, and that is thanks to the requirement of testing before they get to Canada. And amongst the unvaccinated people or partially vaccinated people, the positivity rate is 5.46%. So it's something to monitor. The risk is not zero, it's never zero, but something to monitor. It's less than before, because before the positivity rate was higher, but now with the Omicron wave, it reduced. So I think that we've found ourselves in another position. We're looking at the scientific data, and we may change the policy as time goes by. Question, the percentages you are giving are for travelers who get to the border? Yes, very well. My second question concerns the third dose, the booster dose. The Quebec government is today announcing that young people between 12 and 17 will be eligible for this booster dose from tomorrow. This wasn't the case before. What do you think about this? Are you in favor of the administration of a booster dose for minors? Answer. We are seeing what is happening with vaccine coverage in Canada. Generally speaking, Canada did well. When you look at the vaccination rate for people who received the first two doses, the rate is good. I think we have also seen that when we look at the general population, there is a drop in immunity protection after some months, after about 6 months. We have also seen that with a booster dose, a third dose, protection against various variants, including Omicron, can increase. So I think it's because of science that the government of Quebec and other governments throughout the country are beginning to offer a booster dose to the general population for all those who are eligible, including teenagers. It's also important to see that it is recommended that for people who have completed the primary series, they have to wait 6 months before they receive the booster dose. Thank you.
Thank you. Our next question will be from Dylan Robertson with the Winnipeg Free Press.
Hi, doctors. Thanks so much for taking our questions today. I wanted to ask Dr. Tam what your message is to Manitobans, because we see the hospitalizations are supposed to go up again, but it's nowhere near the peak that we saw last month. And almost all the restrictions are being lifted in the province, but we still have a major backlog in care. And so that will clearly put some sort of strain on that system. So I know you're not here to tell the provincial government what to do, but I'm wondering, what would you tell the public in Manitoba? Should they go above and beyond the masking and gathering restrictions being lifted, or do you have any kind of advice?
Well, I think very key to this transition period, we expect some turbulence or bumps in the epidemic curve, is that individuals can certainly get their booster shots if they're eligible. That you've seen the gap still in some of the uptake of vaccines, even in people who've got the first and second dose. So that's one thing. And secondly, I think masking in indoor spaces when you're not with your household members, that can potentially continue as a habit, as a personal protective measure going forwards. And taking all the knowledge that you have gained over the last couple of years in how to reduce risk based on your personal circumstances, because everyone's a little bit different in terms of the risks and who they're in contact with. But I think the message is that the Omicron virus will continue to circulate. It hasn't disappeared, and will probably continue at quite a high level for a number of weeks, and we're monitoring that very closely right now. And so individuals can take those additional measures based on their personal context. I have to also say that we are presenting national level data, and some of it may be broken down provincially, but they're actually quite different virus activities within the provinces themselves. So there are some northern areas that are actually still experiencing quite high activities compared to maybe some of the bigger cities. And so that should be taken into account as well.
Thanks so much. And as a follow-up, I just wanted to get your thoughts on the modeling itself, because we know this is not a crystal ball, that there's a lot of changes. But a month ago, the projection had Manitoba bound for around 180 hospitalizations a day. The peak ended up being less than half of that. So I'm not trying to criticize. I think we know that these modelings all have lots of caveats. But could you perhaps walk me through what factors might have shaped that different outcome in Manitoba?
Yes, so the modeling shows what could happen, but what actually makes a difference, and I always like to love to see actual data, if it's properly collected, to be better than the projections, because that shows that the measures are working, or people are, the measures themselves, that there could be more measures or more people taking vaccines or other factors that have provided a more optimistic trajectory. The other aspects include, there's the models don't incorporate every single dynamic that is happening with immunity in the population. It's also possible that, quite a lot of infections occurred, which provides more protection for a population as well. And the models also doesn't take into account waning immunity, so they're not there to cover all bases. But I always think that it's great to be proven, as not to have a real life experience that is better than the projected forecast. That shows that people have really taken to heart some of the public health advice.
Okay, our next question will be from Raymond Fillon de TVA.
Oui, bonjour.
Good morning. I would like to ask a question about the graph on page 9. When we look at the red curve to the right, should we take it that the easing of measures could lead to a resurgence and hospitalizations as serious as what we saw at the beginning of the year?
Oui, merci pour la question.
Answer. Thank you for the question, Dr. Njoo here. It's never like a crystal ball, but with modeling, it's always possible with easing of public health measures for us to see a resurgence of infections. Another important thing is that with all the tools we have, we know that infection cases
avoir aussi des autres indicateurs tardifs qui vont
or rather, they could be, it's not like as if there will be other indicators. We are seeing that with Omicron, the serious illnesses and some people who need to be in ICUs, it's less than before. Yes, I believe that all governments throughout the country are closely monitoring. With the easing of public health measures in their administrations and jurisdictions, it's something to be monitored. We need to find out what the impact will be on public health systems. And similarly to severe illnesses, we need to separate cases of infection and also look at what will happen with the impact on the public health systems. Question, when we look at what is happening in Denmark, there was an explosion of cases and deaths from what I saw at the beginning of the week. Are you at ease with what was announced in Ontario and Quebec over the past few days when it comes to the easing of measures coming up in the next few weeks? Dr. Njoo here. Answer. It's not up to me to rule or to say anything on what the government of Quebec did. Together with all the public health authorities, we are all on the same page. Now, we've been able to ride the Omicron wave. So now the provinces and territories are treading carefully and easing public health restrictions. We have to rely on experiences from other countries. And as you said, particularly some countries in Europe, because sometimes they are ahead of us. So we shall learn from their experiences. The same thing with Quebec and Ontario. Maybe they are ahead with the Omicron. Maybe they went through the peak before the other provinces and jurisdictions. It's something to monitor. Of course, we need to find a balance because I think that everyone wants to go back to some sort of normalcy of society as before, but at the same time, we need to protect our healthcare system. That is the balance that all provinces and territories are trying to find. It's something to monitor in the weeks ahead.
Okay, thank you. Our next question will be from Frédéric Lacroix-Couture avec La Presse Canadienne. Please go ahead.
Oui, bonjour à vous deux.
Good morning. We have seen that in some provinces like Quebec and Ontario, they have announced the removal of the vaccine passport in the next few weeks. In your opinion, is this a measure that should have been kept on? Is it too early to withdraw the vaccine passport? We know the impact that this vaccine passport had on vaccination and the transmission of the virus. Answer. Thank you for the question, Dr. Njoo here. Let me start. It's interesting you're talking about the vaccine passport. I believe Dr. Tam and myself observed before that from what we saw from evidence, when a government makes an announcement about the requirement for the vaccine passport, the vaccine rate increases a bit. It's true that that motivated some people to get vaccinated, but it's interesting for me. When we go back to public health principles, we know it's very important to increase vaccine coverage as much as possible because relying on evidence, we know that vaccines are effective and efficient and they provide good protection to the vaccinated people. That is a certainty, and every scientist agrees on that. But maybe it's a personal perspective now, but I think it's something that's very important. Besides quantitative science with the figures and the data and hospitalization rates, we now know that we must properly understand behavioral sciences or qualitative sciences, because all that is important. There are several ways to encourage people to get vaccinated so we can increase vaccine coverage. Of course, various governments used means like the vaccine passport, but it's not only about using the vaccine passport. Ultimately, it's very important to find out what is motivating people. How are subpopulations behaving? Maybe people who have not yet been vaccinated so far. So we need to find out how to find ways of increasing vaccine coverage. It's not only about asking people to get vaccinated or using the vaccine passport. Question. Is it too early to withdraw the vaccine passport? Answer, that's a decision that is up to the provincial and territorial governments. I've said on several occasions that if we want to increase vaccine coverage, it's always better. Well, we've seen that many Canadians rely on science, and we provide information that gives the benefits and disadvantages of vaccines, and we see that the vaccine coverage is very high in general amongst Canadians. If the provincial and territorial governments also want to use other means of increasing vaccine coverage, it's a decision that is up to them. It's not for me to say what they have to do, but it's something we need to monitor in the coming weeks. We need to see what is going to happen looking at the epidemiology. Question, thank you. Looking back to the three scenarios you presented before, is there one that is more likely than the other, looking at the easing measures that the easing of measures as announced? Answer, on several occasions, we've said that we do not have the crystal ball. Canada is a vast country. We have seen that the reality on the field in each province and territory is different. What is happening in Ontario and Quebec may be different from what is happening in other territories looking at their context, population, and epidemiology. I think each province and territory may have to adopt a different approach in easing public health measures. They may vary from one part of the country to another. For me, it's very difficult to tell you now which scenario is the most probable. It's something to monitor. Looking at the country as a whole, it's difficult. With the most populous countries like Quebec and Ontario, what happens in such provinces may have an impact on what happens in the rest of the country, but each province and territory is faced with different realities. Thank you.
Thank you. And I don't see any further hands raised, so I'm going to just take this chance to ask one question on behalf of one of my Global News colleagues. Reminder for anyone who has not asked a question yet, if you want to do so, please raise your hand and I will try to get to you quickly here. This question is for Dr. Tam. Dr. Tam, in your presentation, you mentioned that Canada is transitioning out of the crisis phase. Can you clarify what exactly that means? Are we moving out of the worst of the Omicron wave or out of the worst of the pandemic, do you believe, in general at this point?
Yes, I think in discussion with my colleagues, the chief public health officers, we actually put a collective statement at the beginning of the week. I think we're speaking on both counts. So coming out of the Omicron wave, but also in the more than 2 years of experience with this pandemic, is that there's a significant buildup of immunity in the population. And we have more tools. We have many Canadians having been vaccinated. And we could do with a bit more boosting of the boosters, but many people have rolled up their arms. And we've got treatments now coming on board. We should be able to manage the pandemic going into the future without, I think, some of the more stringent or restrictive public health measures. They may still be needed if there was a very severe variant that escapes vaccine immunity, for example. So we don't want to completely reduce all of our capacities. We want to be able to surge as needed. But for now, I think, given the projections, if we don't get another variant that is very significant in terms of impacts, we should see a diminution of the Omicron wave and be able to return back to some of that normalcy. So I think the idea is not to do that sort of yo-yo effect, for the last couple of years where restrictions have to come on and then they come off and then another resurgence occurs in a way that overwhelms our hospitals. And so I think, and in response to some of the previous questions about the modeling as well, is that the key focus right now are severity indicators like hospitalizations. The cases might go up, but as long as that wave of hospitalizations is not as high, then we can probably cope with that. And with that comes a better balance to have some of the other social and economic activities coming back to more normal approaches. And I think I would divide the next periods of time into different time groupings, if you like. So right now is a transition phase. We're trying to ease out of the Omicron wave. We're trying to take the public into a different space from increasing their abilities to manage their own risks and protect themselves while protecting the vulnerable as well. We might, I think I need to remind everyone there are some groups in our population that are at high risk still of the COVID-19 virus, and we need to collectively help support them. And but then moving into a phase of readiness for the next wave, but really readiness for the next fall. So we have our eye on the medium term of preparing for potential resurgence, but on top of other respiratory viruses in the coming fall-winter season. And then even longer term, the sustained approach to pandemic preparedness, but reinforcing our longer term vaccination programs, should that be necessary for the Omicron virus, for the COVID-19 SARS-CoV-2 virus itself, and other platforms and infrastructures that we need to be sustained and enhanced. So I think we're all looking just slightly beyond the immediate day-to-day management of the response into recovery and planning and readiness.
Excellent. Thank you very much. I don't see any further hands raised, so I believe that concludes our press conference at this point. Dr. Tam, Dr. Njoo, thank you so much. Thank you as well to all of our interpreters for their hard work here, and have a great afternoon, everyone.